Welcome, everyone. We're really excited to have you join us for our Experience VCC virtual open house event. My name is Mike, and I'll be your moderator today. At this time, I'd like to take this opportunity in acknowledging that we are on the traditional and unceded territory of the Coast Salish peoples, the traditional territories of the Squamish, Musqueam, and Tsleil-Waututh First Nations. This session is an opportunity for you to learn more about our healthcare programs. On our agenda, we have program representatives who will speak about their respective program for about 2 to 3 minutes each. Okay, I'm going to turn it over to our program representatives who will take a few minutes to introduce themselves and tell us a little bit about their program. So we'll start off with the acute care for healthcare assistants and healthcare assistant program. And I'll
Hi.
turn it over to you, Domingo.
Hi, good afternoon, everyone. My name is Domingo Salviejo, representing academic advising. And right now, I'm also representing the healthcare assistant program and acute care and MDRT. Now, let's start with the healthcare assistant. Now, this is a very short program. It's about like 7 to 8 months in duration. And we do have a lot of students wanting to go into the healthcare assistant. They actually work in a complex care or um, as home support. Now, a lot of students, they go into this program because they want to venture later on into the access to LPN, which again, from LPN, you can also bridge later on into the nursing or the BSN advanced entry. But anyway, let's go back to the healthcare assistant. As I said, it's a short program, and a lot of you may have questions about admission requirements, and we can talk about that later during the Q&A. Now, Lisa Beveridge, who is the department head, is not here right now. So if you have questions about what they do specifically in the program or what you do specifically in classroom setting, then we will provide you the her email address and you may be able to contact her for those questions. However, for admission requirements, I should be able to provide you with those later if you do have questions. Now, moving in the healthcare assistant, there are two things here: the healthcare assistant regular and the healthcare assistant um, EAL or ESL. Now, this is a longer program. It's 10 months in duration. The reason why it's longer is because it has the ESL component into it. But you're going to be learning the same program as HCA. So in other words, if you take the HCA, ESL, or AAL, you come out and you'll be able to work as it is as a healthcare assistant in a complex care setting or home support. Now, however, if you want to go into acute care setting, then that's the time you need to take our separate program, which is very, very short, which is part-time, and this is what we call the acute care. Acute care is part-time. It's 3 days a week in duration, and upon finishing this program or this short certificate, you'll be able to work in an acute care setting in a hospital, for example. So again, if you're looking to take the program healthcare assistant or healthcare assistant EAL or the acute care program, there's no other school other than Vancouver Community College, of course, to take this because we will provide you with the right training, with the right support. And just so you know, we are actually funded by the provincial government, and this is the reason why our tuition fees are way affordable than private schools. So just to let you know. All right. Thank you.
Great, thanks, Domingo. Next is medical device reprocessing technician, and that's over to you again, Domingo.
That's, I'm back again. Medical device reprocessing technician is a program that is offered by continuing studies. It is also a short program. Now, in this program, there are requirements and that you need to have. Once you complete this program, just so you know, you'll be able to work as a medical device reprocessing technician in a hospital. And just so you know, when you take this program, you're not coming to Vancouver Community College because you're going to be doing this program in a hospital setting. So you may go to VJ8 or St. Paul's, for instance, and take the program. But we will provide you with the diploma that says Vancouver Community College. Now it's a short program, and there are prerequisites that you need to have. Two courses that you need to have are medical terminology, rather, and then intercommunication skills. Now, this is really important for you to be able to be successful in the medical device reprocessing technician. Currently, there's a bit of a wait list in the program, but I don't want you to be bothered by that, because again, seat offering to the program is first come, first qualified. So in other words, you can apply anytime, but we're not gonna offer you a seat until you complete all those requirements. So MDRT is a great program as well if you're looking to work in a hospital setting, and if you like to work with your hands, this is the great program for you.
Okay, sounds great. Thanks, Domingo. Now we'll move over to medical laboratory assistant, and over to you, Heather.
My name is Heather McMullen. I'm one of the instructors in the medical laboratory assistant program. First to say, you're all in the right room, because any healthcare career you choose now is a really good idea. Medical laboratory assistant is no different than that. I think we've all heard a lot more about laboratory testing in the last year and a half than we probably ever have in our lives. And I think coming here, you'll be able to do this MedLab Assistant program. It's a 6-month program. The focus of the program is specimen collection, specimen processing, and ECGs, electrocardiograms. So you get a well-rounded education in all things laboratory assistant. You have 5 months on site at the college, and then 1 month of practicum somewhere in the Lower Mainland at either a hospital or a private laboratory. There's lots to learn there as well. And you might wonder, how do you learn how to, I think I said the word phlebotomy there, so that's blood collection. And you might be wondering, Heather, how do we learn how to do that properly? And the answer to that question is we learn on each other. So you and your classmates become very close, and you and your classmates learn together, and we learn to do phlebotomy through some simulation aids, and then eventually with each other as human subjects. So it's a really fun time, and I hope some of you will join us.
Okay, great. Thanks, Heather. That's really interesting about phlebotomy. Now we'll talk about occupational and physical therapist assistant. So over to you, Carmen.
Okay, hi everybody. Thank you for coming by today. So I am the department head of the Occupational and Physical Therapist Assistant Program. We are a 2-year full-time program. We train students to be physiotherapy assistants and occupational therapy assistants. We have one intake every September of 20 students, and then it's a 2-year full-time diploma. Our diploma does transfer for 2 years worth of university to Thompson Rivers University, as well as the University of Calgary. So if you're interested in completing your degree, this is a great sort of stepping stone towards that. But I'll echo what Heather says, there's a ton of jobs within healthcare. We just had a class graduate actually on Thursday last week, and 80% of them are already working. So they already have jobs. So it's a great program to be in. What you end up doing is typically you'll work in one of 3 places. You'll work in a hospital or a rehab center, or possibly a residential care where elderly residents typically live. And then what you would do is, say you were you might be assisting the physiotherapist to teach people to learn how to walk again. And if you were assisting the occupational therapist, you might be teaching people how to maybe perhaps dress again in a different way after they've had a stroke. So it's a really interesting program. You get to form really close bonds and rapport with your patients. I'll also echo what Heather says, is you get very close with your classmates, because for the 2 years you practice on each other, as you can see these students are doing in the picture.
Thank you, Carmen. And lastly, we have pharmacy technician. Over to you, Jennifer.
Hi, thanks everybody for joining us. So my name is Jennifer. I'm an instructor for the pharmacy technician program. And when you walk into a pharmacy, you might see a lot of people working behind the counter. Some of them are pharmacists, and some of them are pharmacy technicians. And that's what our program does. We train pharmacy technicians. In the world of pharmacy technicians primarily focus on the preparation and distribution of medications. So they do things like procuring inventory, filling prescriptions, making IV medications if you're working in the hospital, or maybe compounding some creams and ointments. The pharmacy technician is a really important member of the healthcare team, because we all work together to make sure that the patient receives their drug therapy. The program is full-time for 37 weeks, and it's over 3 semesters. The first semester focuses on community pharmacy. So if you wanted to work in a London Drugs or Safeway or Shoppers Drug Mart, and then semester 2 focuses on hospital pharmacy practice. So if you were to work in a St. Paul's or VGH or Lionsgate, they all have a pharmacy that services their patients. Semester 3 is a practicum semester, so you'll do 1 practicum in a community pharmacy and 1 practicum in a hospital pharmacy, where you'll get to practice everything that you've learned. And then throughout the program, we've got lots of labs. We've got dispensing labs, compounding labs, and sterile labs, where you're going to do a lot of hands-on practice. So everything that you learn in the classroom, you take it and you practice it in a simulated pharmacy setting. So to work in a pharmacy, it's really important to be organized and have a good eye for detail. Pharmacy technicians are usually the last person who's going to see or check a prescription before it goes out to a patient and before a patient takes it. Currently, there's a great need for pharmacy technicians. So like Carmen and Heather said, it's a really great time to be in healthcare. I think that the pandemic has shown us that a career in healthcare is very stable and very secure. I personally find working in a pharmacy to be incredibly fulfilling, as you help patients navigate their medications and their well-being. Thank you.
Okay, great. Thanks, Jennifer. Okay, we'll now jump into the Q&A portion. So the question that did come in is from Rajbir. Sorry, I hope I pronounced your name correctly. Is there a wait list already? I want to take admission in September in healthcare assistant. And Heather, you answered for MLA. I wonder if Domingo, you could speak about the healthcare assistant program.
Okay. For the healthcare assistant, just so you know, a lot of our programs, the word waitlist is a bit of a misnomer, just so you know, because seat offering to the program is first come, first qualified. So what does that mean? So it means you need to apply to the program. You need to have met all the requirements before we can offer you a seat. So if you're applying and you're not really submitting all the requirements, right? If you're not submitting the requirements, then we're not offering you a seat. So in other words, I want you to apply and don't worry about the wait list, because the wait list, once you see that on the system on your My VCC screen, you're pretty much waiting for your acceptance letter. And the acceptance letter, you get that acceptance letter 3 months before program starts. Now, here's the thing. A lot of students sometimes, when they receive the acceptance letter, they will say, you know what, I changed my mind, or they say, you know what, I'm in another program, or I'm in another school. So what happens to their seat? Now, it's going to be offered to you, right? Now, there is such a thing in our registrar's office that we call standby list. So once you see on your status that says waitlisted, that means you have met the requirements and you're just waiting for that acceptance letter. Once you see that on your screen, that's the time you're going to connect with the registrar's office and say, hey, please put me on a standby list. But because going back to that scenario again, where the student received the acceptance letter, and for some reason 2 days before program starts and says, I'm not going to do it right now, something happened in my life, then what will happen to that seat? So we may be able to call you if you put your name on that standby list and say, hey, suddenly we have a seat availability. Would you like to take it, right? And obviously you're gonna say, of course, right? And if that is the case, make sure that you have the money to pay. So don't worry about the wait list. Worry about how you're going to complete those requirements, because once you apply to the program, all you have to do is start submitting whatever you need to submit. Thank you.
Okay, great. Thanks, Domingo.
Mochigan, do you have a question?
I want to know what's the requirement for pharmacy technician courses?
Yeah, so we have our pharmacy technician website on vcc.ca, and it lists all our admission requirements.
So actually the pharmacy technician requirements are actually quite easy to fulfill rather. So we require grade 12 graduation or equivalent. We require biology 12 C+ within the last 10 years. As well, we also require Math for Health Science assessment. Now, this is a test that you can take in person at Vancouver Community College. And the most important requirement, if English is your second language, you are required to take the IELTS academic. Now, the score that we require should be on the web page. And there's also, you need to attend the info session as well. And there's a keyboarding test that you are also required to do. And I believe for the pharmacy technician, you are required 40 gross words per minute, maximum of 5 errors, I believe. Certainly, you can upgrade at Vancouver Community College. So if you think you need some upgrading, if you say I need to upgrade my biology 12 or the chemistry 11, I think chemistry 11, that's what you need with a C+, then you need to upgrade. You don't need to leave Vancouver Community College. You can stay in Vancouver Community College, upgrade these courses, and then use it towards the pharmacy technician program. There you go.
And what about the English? What level of English? For example, CLB 7 or 8?
Okay.
Yeah.
Good, very, very good question. I'm going to answer that. Now, we are not accepting the Canadian language benchmark for this particular program, because what we require in pharmacy technician is IELTS academic. And I believe the overall score that we require is 7.0. And there are scores individual that we require for each band, for example, for the listening, speaking, reading, and writing. And it should be on the web page. However, going back to your situation, because you just said, I have CLB 7 or CLB 8, what I want you to do is, even if you have those scores, for example, we're still going to ask you to take the IELTS academic, because again, this is a requirement for admission to get into the program. Now, going back to you, here's my suggestion. If you have a CLB 7 or CLB 8, do not take the IELTS academic right away, because number one, IELTS is very expensive. That's about like $300, I believe. I think $300 US, I think. That's a lot of money. So in other words, what I'm trying to say here is, if you have CLB 7 or CLB 8, I want you to take our IELTS prep, because we do have the prep at VCC and we call it IELTS prep, and it's only a month in duration. So take this course as a review, and if you say I'm ready to take the IELTS, then go for the IELTS, because I don't want you to go straight to IELTS, because to be honest, it's 7.0 academic is very high. And so you really, really need to prepare. I also encourage that you use your CLB 7 to take our ESL pathways. What I'm trying to say here is, do not leave VCC, stay on VCC and use your CLB to take our ESL pathways, because there are ways to improve your chances of getting that that high score of IELTS, which is 7.0. So in other words, you can go level 8 in ESL pathways, listening and speaking, reading and writing, and then you can even go into university English later on. Because you got to remember, when you take the IELTS, they're going to be testing your listening and speaking, reading and writing. And guess what? In ESL pathways, we're teaching you all these 4 skills. Okay, so that's something for you to like really think about before venturing into IELTS right away.
Okay, great. Thanks, Domingo. Mojan, I hope that answered your question. We have a question from Winnie Lee. Has the Provincial Healthcare Access Program affected the number of seats for the Healthcare Assistant Program?
Great question. Yes and no, because the reason why is the healthcare assistant program that is funded by the government, that is a 1 year in duration. A lot of students sometimes they would opt for a shorter duration, which is 7-8 months, right? However, the good thing about the HCAP program, and just so you know, we are actually working alongside with the provincial government. VCC is actually one of the training institutions to provide the program. So in other words, even if you go and take the HCAP, which is the provincially funded program, there's a good chance that you might come back and do your training at Vancouver Community College. The beauty of doing the HCAP program is because you don't need to pay, because the provincial government is paying for your tuition fee. However, you're going to be and you're also going to be working right away alongside with a healthcare assistant. So you're pretty much working right away side by side, right, with a healthcare assistant training you, and you're getting paid by the provincial government. And then after that, you're going to come back and do your full training at any institution. And as I said, BCC is one of them. So to answer again your question, does it really impact our numbers? Not really.
Okay, interesting. Winnie, I hope that answered your question. We've got a few comments in the chat. One of them from Olatun. I hope I pronounced your name right. Hello, I have 8 in speaking, writing and reading in CLBPT, but I have 6 in listening. I would like to do the HCA course.
The healthcare assistant, we require listening and speaking 7 and reading and writing 6. So can we go back to that question again? So what's her score again in the CLB?
6 in listening.
6 in listening.
8 in speaking, writing and reading, but 6 in listening.
Okay, so listening and speaking is we require 7. Reading and writing we require 6. So in other words, if there is a good chance for you to take our CAESL, because we do, as I said, we do have the HCAESL. The HCAESL requires a lower CLB score. However, a lot of students would rather retake the CLBPT, which is the Canadian Language Benchmark Placement Test, so they can do the regular program. So I see that you're missing 1 point in the listening and speaking. Unfortunately, we won't be able to admit you to our regular HCA, but certainly you should be able to apply for the HCA ESL. But just to caution you, if you're asking me as an advisor, I would say take the CLBPT again, and hopefully you get a good score. Now, another thing to think about is, can I take the ESL pathways and then can I use that to take the HCA? Unfortunately, we no, because the BC Care Aid Registry requires the test. So even if you say I wanna use my CLB to take the ESL pathways, when you come out from the ESL pathways, you won't be able to use it to apply to our HCA. However, if you take our ESL pathways and retake the test, I'm pretty sure you'll get a very good score, and you should be able to get that score that we require for the healthcare assistant. Hopefully that answers the question.
Okay, great. Thanks, Domingo.
You're
Another
welcome.
question in chat from Ravneet. Hello, I want to ask if we would like to enroll in LPN/RN nursing programs. And we already studied in Canada for 2 years and 4 months. We still need the IELTS.
Okay, so I can answer that question, and just so you know, the LPN and RN, that was yesterday's info session, but I can answer definitely that question. Now here's the thing. For the LPN and for the RN, we require 3 years continuous studies. So if you say I studied 2 years and 4 months, unfortunately, that's not 3 years. So in other words, you're still going to be required IELTS academic. Now, if you're going to come back to me and say, can I continue and study for additional 8 months plus 4? That's 1 year. So in other words, 2 years plus 1 year, obviously it's 3 years. Can I use that now to apply to the LPN or RN, and I won't be required to do the IELTS? And the answer is yes.
Okay, thanks, Domingo. A question from Shannon in the chat. I've applied for the CDA program. I also applied last year and submitted all my prerequisites. Will these be automatically transferred to my new application, or do I need to resubmit everything again?
No, you do not need to resubmit again. What I want you to do is I want you to connect with the registrar's office, and the email address is ro@vcc.ca. Just email and say, I want to be able to use my documents or my requirements, because I'm already on, again, the word waitlist. Because if you have met everything, all the requirements, all you have to do now is wait for your acceptance letter. So in other words, you don't need to reapply and resubmit, because your documents are already in the system.
Okay, great, thanks. I think there was a follow-up question from Ravneet about HCA. Could you please confirm if I study HCA that will be counted in 3 years? Oh yes, this is the LPN and RN nursing. Yes,
Okay, good, Ravneet. Yes, so if you're the person with 2 years diploma, and then you have the four months, and if you take our healthcare assistant program, and that would count to 3 years, definitely. So it's a yes.
Okay, thanks, Domingo.
I just want to make sure that I'm not confusing other programs. For example, pharmacy technician, because pharmacy technician requires IELTS academic. Now, if you're gonna ask me, if I study in Canada for 3 years, do I still need IELTS for pharmacy technician? And the answer is yes. And just so you know, even if English is your first language, you are still required to take an English language proficiency for pharmacy technician. Just want to make sure that I'm not confusing you.
Okay, thanks, Domingo. There was a question submitted in the Q&A, and I just thought I'd share that with you because it's an interesting one. It's from M. Hi, Heather. What is the passing rate of MLA? So Heather's response was that our plan is to always graduate 24 out of 24 of each cohort. So that's really encouraging to hear.
I would like to ask, would I be able to apply for admission for HCA in 2022? I'm going to answer that. Ravneet, what I want you to do is I want you to apply to the program online, because when you apply online, it will bring you to the BC Ed Planner, okay? Now, in the BC Ed Planner, it will actually give you the possible intake where you will begin the program. So if it is letting you apply, for example, if you see, September 2022, then apply, okay? But sometimes you're not gonna see September 2022. Instead, it's gonna be another month, 2023. I still want you to apply to that program, because as I said earlier on, our policy when it comes to seat offering is first come, first qualified. It is not first come, first serve. Okay, there are programs that are competitive, which is GPA based, for healthcare assistant or even MLA or even pharmacy technician. It is first come, first qualified. So in other words, just apply online to the program, and when you get to the BC Ed Planner, it will actually, you can choose when you wanna, which intake you wanna apply. If it's letting you apply for September 2022, go for it, okay? But at the end of the day, you need to meet our requirements before we can offer you a seat to the program. And again, it's first come, first qualified, meaning there's a limited number of seats.
Thanks for clarifying that, Domingo. Okay, a question from M. After submitting the application, do you tell us right away if we are not qualified for the program?
Okay, because you'll be able to see your application status. Okay, you're not gonna see it right away after you apply, because it will take I would say maybe a week or two before you'll be able to see your application status. You got to remember that it all depends on the registrar's office, and we get a lot of documents, and we have to manually put that into the system, so you'll be able to see it right away. So that's why it takes about maybe a week or two before you can see your application status. Now, if the application status, you're missing some of the requirements, then that means that you need to submit those transcripts. For example, if you're applying for the pharmacy technician and it says that you don't have the biology 12, because yours is already expired, then it will say on the application status says expired biology 12. So meaning you need to retake biology 12 and get a C+.
Okay, thanks, Domingo. Olatone is asking, how can I book a one-on-one session? I presume that's with an advisor. Domingo, I think it's vcc.ca/advising, right?
Yes. There's another question here. For students who have studied in Canada, there is an alternative ELP. It was the ABE, but currently doing Duolingo since ABE is not available. So people who you were born in Canada, grew up in Canada, and English is the first language, so they want to do the pharmacy technician. As I said earlier, they're still required to take the English language proficiency. And if that's the case, right now, because of COVID, we are letting everyone to take the Duolingo English test. And this is only for people whose English is their first language. Now, if English is your second language, Duolingo is not for you. It is the IELTS academic.
Question from Rajbir. I don't have biology in 12. Is this necessary?
You're the one who wants to do the HCA, correct, Ravneet?
Yes.
If I'm not, okay. You do not need biology 12 in the healthcare assistant. We need the CLB, Canadian Language Benchmark Placement Test. If you studied in Canada, high school in Canada, then your English 10 or your high school graduation will suffice. But if you came to Canada, then you have to do the IELTS academic, or you can take the Canadian Language Benchmark Placement Test. And unfortunately, we are following the BC Care Aid Registry as far as the English language proficiency is concerned. I know it's a bit confusing, and this is the reason why we really want you to speak to an academic advisor, because it works for other program and it doesn't work for other program. You know what I mean? So in other words, for HCA, you are required to do the Canadian Language Benchmark Placement Test, or IELTS General Training, or IELTS Academic.
Mike.
Yeah. Hi, Angela.
Quickly chime in. So I wanted to remind international students that I'm not sure how many are here right now, but if you're interested in healthcare assistant programs, we have one that is a 2-year diploma program, not a 7-month or the 10-month ESL certificates. The program that is designed for international students in healthcare assistant is a 2-year diploma. So if you have additional questions, feel free to let me know or ask right away. But yeah, just wanted to clarify that the type of programming is different for international students versus Canadian students.
Yeah.
Okay, thanks, Angela. That's good clarification. I've got a few more slides to just wrap up. So I'd like to bring to your attention our services for students. So we have advising services, which I hope you're fully aware of, with Domingo, who represents the team. We also have financial aid. We have Indigenous services, disability services, and counseling services. And we also offer free professional tutoring. So if you're interested in learning more about any of these services, just go to vcc.ca/services. For next steps, Domingo had mentioned this earlier. We do encourage you to attend info sessions. Just go to vcc.ca/info. Also, you could also meet with an advisor. So, you could already tell Domingo and his team are a very friendly bunch, happy to answer any questions you may have. And you can make an appointment at vcc.ca/advising. And if you're ready to apply, then just go to vcc.ca/apply. Well, thanks everyone for joining us today. We look forward to having you join our community, and hopefully we'll see you on campus.